All right, let's talk about the big heart here. Let's start with the vessels above the heart. We have, here's the ascending aorta, okay, coming off the ascending aorta, this branch here, right coronary artery. The left coronary artery is coming off too. It's right there. Left coronary artery, a branch of the ascending aorta. Here is the aortic arch. Branches of the aortic arch include, right here, the brachiocephalic trunk, the left common carotid, the left subclavian, right here, number 11. Let's follow the brachiocephalic trunk up. It branches into the right subclavian and the right common carotid. Let's do the veins. The vein running with the common carotid are the internal jugular veins, number 17. It merges with the subclavian vein to form brachiocephalic vein on the right. There's left brachiocephalic vein, number 7s. They merge together to form the superior vena cava. Okay. You also have the pulmonary trunk right here. It's from the back here. Oops. We also have pulmonary artery there, pulmonary artery there. Here, this would be the descending or thoracic aorta. These branches here would be the posterior intercostal arteries. These right here, these red vessels going into the left atrium, pulmonary veins. Let's go to the front of the heart. Everything's fallen off here, so we can look at the internal structures. Okay, so we have right atrium. We have left atrium. This edge right here looks like an ear. It's the right auricle. It's the left auricle, basically the edge of the atrium. If we look inside the atria, we have a comb-like appearance. That's pectinate muscle. This is on the inside of the right atrium, so therefore that is the SA node. If we look inside here, inside of the right atrium, number 100, it's hard to see there, that is the AV node. Okay, see that blue dot right there inside of the right atrium? That's the opening of the coronary sinus. That is the opening of the inferior vena cava. That's the opening of the superior vena cava, all going into the right atrium. Okay. Here's the opening of the left atrium. There's the pectinate muscle. So you kind of see, like, if you see like a red opening in there, pulmonary veins going into the left atrium. Let's look at the ventricle. Here's the right ventricle, where it kind of funnels up right there. That's the conus arteriosus, right below the valve, the pulmonary semilunar valve, right here. The other valve here on the right side, this is the tricuspid valve. These right here are chordae tendineae, and you have like a papillary muscle right there. The internal appearance of the ventricle is the trabeculae carinae. If you look on this side, little 7 is a bundled branch on should be on the left side. 108, all those small little lines, Purkinje fibers. 108, so you have to know that too. Okay, well, the valves over here, this is the left ventricle, so that makes this the bicuspid valve. There is the chordae tendineae, there's a papillary muscle. If you look up in there, that's going to be the aortic semilunar valve. Let's do some more coronary vessels. I got to put the thing back together. Okay, let's follow the right coronary artery when it gets a branch along the right margin of the heart. Right marginal artery. The vein that runs with it is this small cardiac vein, the one called the widowmaker right here. Left anterior descending or anterior interventricular artery. The great cardiac vein runs with it. In the coronary sulcus right there, you have the circumflex branch or the circumflex artery. Okay. If I ask you to identify this sulcus, it's the anterior interventricular sulcus. Okay. Let's remember, the anterior interventricular artery has the same name. Let's go to the back. The sulcus back here is the posterior interventricular sulcus with the posterior interventricular artery, the vein that runs with it, middle cardiac vein. That is the coronary sinus draining into the right atrium. Okay. And I think that's it. Go ahead and